more good evening, everyone. I am happy to be part of the team trying to calm down and reduce the incidents and also the effect of drug and substance misuse among persons in Cameroon, particularly in the north and southwest region of Cameroon, trying to make sure that this knowledge is available to everyone across all age groups. So today I'll be addressing understanding substance use disorder, particularly talking about what makes people get into it and equally the risk factors. So that as lead advocates of drug and substance abuse, we can all together understand how to transcribe this information to the others. It might slightly be a little bit long, but the reason is because this is more of a trainer's training, a trainer's or advocate's training. So that is why you bear with me and follow as I present. So what is substance use disorder, which is typically abbreviated as SOUD? They are typically mental conditions, which is actually a problem in the patterns of the things that the person who is subjected to uses, and usually it causes distress or impairs their life. Meaning that when you are using something to a level where it impairs your life, particularly a substance, or causes you distress, it means that you are already at a level where we can begin to characterize you as abusing it. That is to say, without it, you are not feeling like you are yourself. Without it, you feel like your life is impaired or set back. So there are many things when it comes to substance use disorder, and when we talk about their severity, it could be done using several criteria, or you could just simply look at it from mild, moderate to severe. But there are other criteria where you use to identify the degree of dependence that people have. So when we want to talk about substance abuse, we also think of it as involving a desire that is overpowering. In fact, you have this desire that you cannot conquer to use substances, and it goes along with increased tolerance to those substances, meaning that for you to get the same desired effect that you want from the substance, it keeps making you to increase the dose. That is to say, if you were taking 2 bottles, now you want to take 4 in order to achieve the same effect. So this is what we typically describe as the tolerance is increased, so you would want to take more of the substance. And of course, it also has, along with it, sometimes withdrawal symptoms. When I say withdrawal is if you spend time without taking the dose which you want for this drug, you are going to experience certain symptoms. For instance, people who are chronic alcoholics, when they stop, you find them trembling. That tremor is a withdrawal symptom. So these are the spectrum of things when we're talking of substance use disorder we talk about. So remember that it makes somebody's life impaired, meaning that without it they are distressed and they feel like they cannot go on with their life. And it may often lead to increased doses so that you can achieve the same desired effect in your body. And of course, the desire to overcome this is there, but it is always overpowering you, and sometimes it is coming with what we call withdrawal symptoms. So a person can have more than one use substance. That's typically when we talk about multi-drug use disorder, meaning that somebody is abusing alcohol, abusing cocaine, abusing cannabis, all at the same time, which is typically what we observe in today's experiences, because most people who are addicted to one thing tend to get addicted to the other things because they use all of these substances at once. And typically the use of it can affect somebody's health as well as somebody's relationship and the overall quality and productivity of the person. It can also be very life-threatening. That is to say, it can make some people go to the level where their lives are immediately at risk. I mean, they are at risk of losing their life. So it is very important to seek help and also find out that if people are at this level, they should get the help they need, because some people can lose their life at that point. So what are the substances that most often people get addicted to? I will discuss it again subsequently in the part 2 of my lesson. So substances that are mostly possess addictive potentials are the ones people get used to. It can also be prescription drugs, not just these illicit or recreational drugs that we have around. Prescription drugs can also be taken to the level where it becomes addictive, as well as illicit drugs or non-medical drugs. So this non-medical group of drugs include alcohol, caffeine, cannabis, marijuana, and other hallucinogens. Other hallucinogens, we have a lot of them, especially things like thiopentadol. We also have even diazepam, and we have other things too, like the cocaine and the tramadol. So there are lots of them. So prescription and non-prescription drugs that have stimulating properties or addictive properties. The fact that they are addictive means that they have certain chemicals in it that make you want to always take them. That's why we talk about addictiveness. And so these things that are always found there that are addictive are of many types. There are many things that can make somebody depend on something. And these things are usually what stimulates those maybe happy appetite or happy notes in you, or stimulates the fact that you no longer remember your problems. For instance, if you were taking them to forget about the bad moments and difficulties you're facing. So that is a stimulant. So stimulants are what make people to get used to and want to take a certain drug all the time. And these stimulants are of many types. They include tobacco, nicotine, especially in cigarettes and electronic cigarettes. Most of them, like this vaping, I'm sure most of you know that it is associated with a lot of health problems, but people get addicted to it because they have this nicotine or the tobacco, because they are also giving them some kind of satisfaction. We also have hypnotic drugs. Remember, we talked of hypnosis, we talk of drugs that excite you, hypnotize you, relieves you from anxiety, and of course drugs that make people sleep. So these groups of drugs all together are things like these benzodiazepines and barbiturates. I'm sure you mostly have heard of diazepam, which is mostly abused. People take it to sleep, but over time they start using it for other things. They also take it to sedate themselves. Diazepams are common because they are benzodiazepines. There are other groups called barbiturates. There are also things that people inhale. I'm sure we've all heard of the drugs ecstasy, and we've heard of other things that people inhale just in order to feel. I was really shocked when I heard that people also inhale gum, like chew gum. I don't know how it really excites them, but people inhale a lot of things to elicit certain emotions or certain things they want to achieve. And perhaps I think they inhale gum because it could be made of sulfur products. Sulfur, and maybe sulfur is also a very great content of methamphetamines that gives people a lot of excitement and also gives them certain moods and feelings and also sensations. So in a nutshell, why do people get addicted to drugs? Because they have addictive substances in them that provoke certain emotions, certain feelings, and this is what makes people attached to these drugs. We have nicotine, which is found in cigarettes. We have hypnotic properties and anxiolytic properties that is found in things like benzodiazepines and barbiturates. And we also have inhalants that can give people moods that are good, especially things like ecstasy in clubs and so on and so forth. So prescription drugs too, like I mentioned, things like tramadol, codeine, oxycodone, those are things that are used to relieve pain, but sometimes they can, if taken out of the rightful prescription, they can lead to dependence because they have these properties that are addictive. So how does these substances work? The reason why people get addicted to a substance First and foremost, like I said in the previous slide, is because it excites certain things, and the majority of these substances excite an individual at the level of the brain. So you will take these substances by whatever route. It could be through your vein, it could be through drinking it like tablets orally, or it could just be inhaling it through your nose. When you inhale now, these substances get into the blood and eventually enter your brain. And when they enter the brain, what most of these substances do is that they interact with what gives you pleasure or reward. We call it the reward pathway in your brain, and causes your reward pathway to be overstimulated. And when your reward pathway is overstimulated, what becomes of you? You feel good, you feel like everything is okay, and by virtue of that, you will not want to let go of that drug. You want to use it again so that you can have the same feeling, and that is what leads most people to want to always get back to this drug, to use it to provoke the same situation and have the same emotions. And so dependence or addiction now comes when they use it repeatedly to a level where they can no longer control themselves. This affecting their lives, is affecting their families and relationships, and they don't have the power to overcome this. That is when it becomes a substance use disorder, and often is accompanied with withdrawal symptoms when they stop using it. So what is the difference between substance use and misuse or substance use disorder? There are actually slight differences. This is just for you in terms of terminology, as our course outline wants us to discuss, to understand the use of these words. But typically when we say drug addiction, it is scary, it makes people frightened. But when you use the word substance use disorder, it might make it more friendly. That's why typically on talking to people in TV, media, like the radio, or also massive or public campaigns, sometimes using the word addiction can make people shy away from opening up. So substance use or misuse refers to occasional episodes of use rather than a chronic. So when you have misuse, you can just have occasional. Maybe for instance, somebody can occasionally abuse alcohol. That is, they don't take it all the time, but when they want to take it, they take it to limits that or excessively beyond the level where they cannot handle. So that is when we use that word. People can also use substances occasionally, but they don't develop substance use disorder. That is to say, you can have a few episodes of taking a certain substance, and it can lead to tolerance and dependence, but you don't have that tendency of it affecting your life, affecting your family, or you have control over it. That is what I want to say, for instance. So it is just as simple as that. You can use a substance, but you don't misuse it, as well as you can use a substance and you have control over it, as well as you can use a substance and you use it repeatedly without, each time you use it to levels which are not acceptable. And that is how you have people who have misuse disorder, but they don't have substance use disorder. Substance use disorder is more of a habitual pattern, while a substance misuse is just an occasional misuse without any habitual patterns or addictive patterns to it. I hope this is clear. So we already know the kind of substances that are being abused and why. Things like cocaine, alcohol, cannabis, which is another name for what we call baga in simple language here in Cameroon. Some people call it weed, whatever, wherever you are. That's typically what that is. With benzodiazepines that are prescription drugs. Always remember, people can abuse both prescription drugs and non-prescription drugs. So there's a criteria that is often used to say somebody has a substance use disorder. There is what we call the DSM criteria. There are other criteria that were existing before. So on this, I will actually just look at a few things here. In fact, it spans through analyzing a variety of problems that arise from the use of substance. It covers like 11 criteria. So we first of all talk about taking the substance in large amounts and for longer than you want to take. For instance, you go and you're like, I want to take a bottle of alcohol, which is found in, it can be whatever alcoholic beverage, Guinness, can be ice, whatever you want. You go for one bottle, but you realize that you go and when you take one, you keep having cravings and you end up taking more than you needed and for longer than you wanted to take. Now the second thing is that the person wants to cut down and stop using substance, but he manages and he's unable. The third thing is that he spends a lot of time getting and using and recovering from the use. It's like time is being wasted. But he keeps having cravings and urges to use it. That's the fourth thing. So asking these questions to yourself: do I take more than the amount I wanted to take when I am exposed to taking it? That's, if you say yes, it means you've ticked that box. Do you feel like you want to cut down or stop using it, but you don't have a way to, or you cannot manage? If you say yes, you tick it. So these are questions that you're asking to see if you really have a substance use disorder to a particular substance. Do you have cravings or urges to use it? Like, do you have cravings to smoke? Do you have cravings to drink? Do you have cravings to, for instance, take cocaine or take tramadol? If you say yes, so by assessing all of this, you can be able to come out and see, okay, this person has a substance use disorder. Not managing to do what you should do at work, at home, and so because you're using it, it is affecting what you should do at work, at school. Most of them are dropouts, most of them no longer work because the substance use now is affecting them at work. So if it's a yes for a question like this, it means it's a problem. Do you continue to use it even when it causes problems in your relationship? For instance, you're using it, your spouse is saying you're over drinking, you're over smoking, but you keep using it. You find it difficult to overcome. There is a problem. Another question is giving up on important social, occupational, and recreational activities because of the use. For instance, you no longer go to church. For instance, you no longer go to maybe your dance group. You withdraw and you're always in the house because you want to take it. If you say yes, it's a problem. Using the substance again and again, even when it puts you in danger. Some people drink, get into accidents, drink, fall into the water, drink, get burned, get into fights and get traumatized, but they still go back to drinking. It means there's a problem. Do you continue to use even when you know that you have a physical or psychological problem that could have been caused by or made worse by the substance? Some people have hepatitis, for instance, and they say stop alcohol, they keep taking it. Some people have a chronic obstructive pulmonary disease, for instance, they say stop smoking, but they cannot stop. It means that even though they are aware that it can cause problem to them, they still cannot resist. If you say it's a yes, it means there's a problem. Needing more of the substance to get the effect you want, meaning that I used to take 2 bottles of beer, now I want to drink 7, 8, 10. You keep increasing the effect because you want to derive that same excitement and pleasure. It means that you're developing tolerance and you're using it more than you're supposed not to use. Developing withdrawal symptoms, like I said before, when you stop taking alcohol or you stop taking a certain thing, you start behaving in a certain way. If somebody keeps saying yes, yes, yes to all of this, it means there's a problem. So when somebody can tick all of the previous questions, you can now carefully say that truly this person has a problem with the use of that substance. And now you can definitely now grade them. Are they mild, are they moderate, or they severe? When somebody has 2 or 3 of the symptoms that I've mentioned above, you can say it's mild. If it goes to 4 to 5, you can say it's moderate. When it goes to 6 or more, it indicates that it is a severe use disorder. So what is the difference between substance use disorder and addiction? This is another thing for you to know because it is important to separate the lines. People are always psychologically dependent when a drug is so central to their thoughts, emotions, and activities that they need to always continue use before use and its use, and it becomes a craving and a compulsion despite its negative use. I want to emphasize that here most people, especially drugs that excite the pleasure centers of the brain, it usually leads people to use, even when it is hurting them, they keep using it. Now, because they were using it for the pleasure it gives, and that pleasure is so good to them that they ignore the dangers that it has to their health. And that is where most problems come in when we talk about substance, drug and substance use disorder. With physical dependence, your body has adapted to the presence of the drug in your body. Like I said earlier, some people would want to step up the dose. Remember that when you introduce a substance into your body becomes used to. And when it adapts to the presence of that substance, it now will begin to require that before you have the same pleasure or effect, you should be stepping up the dose. You see, so when you begin to step up the dose now, and suddenly one day you just stop taking the drugs and it's no longer in your blood, and your blood was used to, your system was used to, it begins to have what effect? Withdrawal effect. And in the past, healthcare providers and organizations and members of the public often use the term addiction and abuser and dependence when referring to substance use. Remember, I mentioned above that when we talk of substance misuse, it doesn't mean substance use disorder. So for somebody to have a substance use disorder, they must answer to those 11 questions. If they have 3 of them, it is mild. If they have 4 to 5, it is moderate. If they have 6 and above, it is severe. So the fact that somebody gets up and go and use a substance abnormally, but comes back and does not go again in a long while, it means he has been a substance misuse, not a substance use disorder. Again, I'm referring to that so that you can be able to use the word misuse and use disorder. Use disorder is a persistent problem. Misuse is just a momentary problem. I hope that is clear enough. Now, when we talk of the terms addict, abuse, abuser, and dependence, they are very strategic words, and that is what we're going to discuss. So the word, let me just discuss them. So the word addiction is substance use disorder that is of the greatest severity, that's above 6. When you take all the 11 questions and you have 6 and above, we consider you being addicted to a substance. And when you are addicted to a substance, you are an abuser. But not every abuser is addicted to a substance. Not every abuser is addicted to a substance. Remember, I said you can go momentarily and abuse something and you never go back to it. At that moment, you are an abuser. But after that moment, you did not continue to do that, so you never became addicted, or you never became somebody who disuses or who misuses a substance to a level where it ticks up to 7 of the boxes of the questions that are always used to evaluate an abuser. Now, dependence refers to somebody who has introduced the drug into their system to the level where if they stop taking the drugs, they start facing withdrawal symptoms. That's dependence. So how common is substance use disorder? Is very common among all ages, races. It's a global problem. It's not only in Cameroon, in the US, in Canada. Go to the streets, they are littered all over. It is a problem that is everywhere and affects all age groups. I mean, sometimes people assign it to male and male that they are more likely to develop substance use disorder. Yes, that is just studies have revealed that, and substance use disorder has been identified to be mostly among people from 18 to 25. Why? Because it's the age where they explore, they are trying to find out new things, they are trying to know what is out there, trying to identify with different age groups. And in 2021, in every 17 people between 15 and 64 in the world, it is known that they have used a drug within the last 12 months. That means 1 in every 17 people of this age group 15 to 64 uses a drug within their past 12 months. And it is estimated that the number of users have grown from 240 million to 296 million in 2021. That's about 5.8% of the global population within 15 and 64. In fact, if you know the number of millions of dollars that are spent on drugs, you will be very amazed at how much people spend on drugs because they want to get excitement. So the issue of drug and substance abuse is also predominated by the fact that people make a lot of money out of it, and so the world is in a serious problem, and the problem is not only precipitated by the fact that people get excitement from it, it's also precipitated by the fact that people make a lot of money from it. So that being said, so how common is substance use disorder in Cameroon? According to the National Anti-Drug Committee in Cameroon, 21% of the population has used drugs, and 60% of these 21% are between 20 and 25, and some of them are predominantly university students. And in addition, more than 12,000 children under the age of 15 too have been involved in narcotics and other psychoactive substance uses. And that is why it is pertinent for us to discuss this. You should know that it is a serious burden to Cameroon's population. Worst of all, the youths between the ages of 18, like you see, to about 25 is very typical. Now, because their elder brothers and sisters are into it, those that are under 15 are beginning to pick up. So you see that it's a cascade of trend that is living from the elderly to the middle to the young ones. So what are the risk factors? We'll typically discuss the risk factors here as family factors, community factors, and also social factors. So the risk factors are typically what predisposes people to becoming users of drugs in a way that is affecting their lives over time, leading them to having mild, moderate to severe substance use disorder. Remember, you grade them based on the criteria given above. So these risk factors are broadly classified into the individual, the family, and the community risk factor. Community and social is the same. Family risk factors is very critical, which is talks about how the family life can lead people to it, and individual risk factors, which talks about how people's personal traits or individual lives can lead to it. So we'll begin with personal traits. And when we talk about personal traits, there are things that are particular to a specific individual that can lead them into becoming substance use abusers. If you look on the right of your screen, you will see depression, mental health disorder, lack of school, low academic achievement, and gang membership. Typically, this is everything about the individual that can predispose them to it. People who have mental health issues, some people are born with certain issues that affect their mental health. You find them use this psychoactive drug not because they want to, but because they are mentally sick. And so because they are mentally sick, they find themselves often within the premise of abusing these drugs, and they take it without even making judgments. It's like even if you make it available to them, they feel like it is for their use, so they don't care if it's beneficial or not. They don't have those secondary judgments, they just take it. People going through depression too, seemingly they try to get out of depression, and sometimes they have to convince themselves by the use of drugs in order to become happy again. And there are also people who want to belong to a gang, like in I can say, for instance, gang membership plays a lot around the social and community. They want you to become part of their gang, so they tell you have to do this, do that in order to belong, and so you do it to belong. People who don't perform well in school, they feel like since I'm not good enough, maybe I should just find a way of handling myself through other things. So depression, these are a list of things here. Feeling sad, misery, and clinically sometimes defined as person with depressive symptoms. That's clinical way of defining depression. And when you have depressive symptoms, it affects your day-to-day activity. We begin to call you a depressed person clinically. So it may also be brought on by stressors. Parental separation, divorce, parental substance use, and family issues can lead people into that. And it could also come from other things beyond just that. And it could also have pressures, especially people's temperament, issues around temperament where people compete and are not meeting up with the standard of competitors, and they feel like they are not good enough. And some teenagers have claimed to be a motivating factor in their decisions of starting the use of drugs, because they are trying to compete and meet up with the pressures that are coming from their peers. So research has also found that people who are depressed, especially in the girls, that depression affects girls, they are more to have these addictive issues 4 to 5 times higher. Meaning that when you get a girl depressed, she has 4 to 5 times increased risks of becoming an alcohol or a drug abuser. And when they do that, they suffer a lot from its effects. Anyways, what takes them into it is typically depression. And depressed males are worse more, thus they have 12 times more risks of becoming alcohol dependent. And according to other studies, boys are more likely to experience depression and alcohol use, whereas girls are more likely to experience sadness and nicotine use. Alright, so gang membership, like I said earlier, they just want to belong to a group, and because they have given conditions to belong to a group, they need to go through taking drugs and becoming like their gang in order to identify with them. And research has shown that there is a strong correlation between gang membership and the use of substances. And it's also demonstrating that having a supportive parent childhood can help you avoid this. But when you have authoritative and you lack supportive parenting, most often you tend to find yourself in gangs and use of drugs. Typically family. Mental health issues, like I said earlier, people with mental health challenges cannot resist it, and sometimes they are often exposed and they are posed to get into these other abusive substances, and the dependence is always much, and there's a significant and persistent relationship where a specific mood, anxiety, as well as behavioral disorders and past drug use problems can also become, in fact, a cause of mental health issue, and can also result into persistent use of drugs in an abusive way. Lack of connectedness just simply talks about especially you feeling that you belong. It can be at school, it can be in the family. When you lose that connection, it can be in a relationship, you can easily turn into the use of drugs, alcohol, and many other things. Research has also shown that when you have zero tolerance policy for drug, it doesn't affect the way people use drugs. If you come to Cameroon today and say nobody should smoke weed, nobody should drink alcohol, you still find out that it doesn't affect the number of users and the level of abuse. So that is why we are identifying this as a need for the community to sensitize the community. Because whether there are policies or no policies, research has shown that people still tend to behave the same way towards the substances. That is how serious this is. And finally, some people, when they lack supportive families, they find out that their peer groups are more supportive, they belong to them better than the family. It's just, for instance, you see a child would prefer to tell a friend something than telling the parents. That's to see they are more belonging. They find themselves a lot more attached to outsiders than insiders. And of course, it is the pathway to finding drug and substance misuse very much. Low academic achievement. Most people, research show people who perform better in school are less likely to become involved in drugs. People who perform bad in school, they easily get to use drugs or substances, which is the reason why you find it that those who perform poorly are those who abuse drugs a lot in school. So family factors, typically these are them here: parental support, supervision, good socioeconomic condition, neglect, child abuse, family history. So these are things that if you lack a parent supporting you and never supervising you, you can easily become an abuser. If you have a parent who is always authoritative, not letting you even have a say or an inch, typically you might find yourself using other things to feel like you are, to feel happy, in order to avoid all the mood things that comes along with authoritative parenting. If you have a family where the father smokes, the father drinks, the mother smokes and drinks, the children will just copy. It is as simple as that. When you abuse a child a lot, they might tend to run out to their friends and find comfort elsewhere and get introduced into gangs, into people's arms that are substance abusers, and so they get introduced. You neglect a child, you open a door for them to become explorers of different things, and before you know it, they are exploring drugs. Now when you have a socio-economic environment that is not good, you know that the poor mostly get to use most of these things because they want to have a way of soothing their poverty, soothing their misery, and that's how they cause more health problems to themselves, and they will still have no money to handle these health problems when it eventually surfaces. So I've explained that already, so these slides are just to help you explain them detailedly, like authoritative parenting, lack of parental support, neglect, family history of substance use disorder, and parental supervision. You don't know your child's location, your activities, all of those lapses that you don't give to the child, it can expose them to become abusers of drugs and depending on drugs over time as a substance use disorder. Family's socioeconomic status, like I said, when you are very poor, things are not going, find out that you start involving in drugs at a very early age. If God does not help you to resist the temptations, you might realize that you are soaked into it after a long while, and you find out there's no way of going back. You become a substance use disorder, person of substance use disorder. Child abuse, physical abuse, anything that you do to a child that abuses the child may eventually lead them into it. And study shows that 29% of maltreated children are using substances, and other 16% of maltreated children misusing it. Remember that substance use and misuse, they are in the same family, but they are not exactly the same. So community factors, I mentioned them earlier already: peer pressure, emotional abuse of the community, association with friends or peers that are delinquent. In fact, this one is predominant a lot in the community. You are with friends that are delinquent, and then they tell you if you don't do this or that, you cannot be among them. When they do that, they respect them in the community. They see them as people who are strong. Then when it comes to bullying, when they bully you, some people will get bullied in school. It means they are weak, and their friends have to tell them how they can get to be strong. Maybe one of the ways is to take drugs and become strong so that you will not be bullied again. And then the worst thing is early availability of drugs. Your parents drink and keep whiskey at home. The child comes and takes and sees. When it's so available to them early on, they become abusers. And emotional abuse can be social factor from relationship to many other things. So typically these are the community factors. I will not really explain them in details again in the subsequent slides. So when you're associated with delinquent peers, I've explained that already. Drugs available, peer pressure, bullying in school, emotional abuse. So this is it for part 1. I will discuss part 2 shortly after this, where I will talk about some few drugs and the various ways they are abused and how you can identify which of them. But again, most of these drugs are most of these abusers use all the drugs, because when you start with one, you eventually use all. Remember, substance use disorder is different from substance misuse. Addiction simply means you have substance use disorder of more than 7 on that criteria. And substance misuse just simply means you've used it once and you've abused it once and subsequently you did not do it. And it is affecting a lot of youths, and the risk factors are predominant. If you look in our community where we are faced with socio-political crisis, poverty and unemployment is predominant. It means that people are poor, people are emotionally depressed, people don't find ways of getting out of poverty, so they turn to substances to get this done. And a lot of gangs have risen up, and so people are trying to identify with gangs, and by doing so they are initiated into substance misuse and eventually become develop substance use disorder and become addicts. So thank you very much. If you have any question, we'll discuss them in the WhatsApp group.